Hello, my name is Scarlett McCullough, and I'm presenting on teen pregnancy and contraception policy. Just a little bit about the history of contraceptions. They've been around since about 3000 BCE with the use of fish bladders, linen sheaths, and animal intestines. In America in 1873, the Comstock Act was introduced, which prohibited the information, education, and distribution of birth control. In 1916, Margaret Sanger opened up the first birth control clinic in the country, where she was arrested and eventually reopened it. In 1960, first oral contraceptives were introduced by the FDA and approved through a pill. Two important Supreme Court cases happened within a decade of each other in the 60s and 70s. The first one, Griswold versus Connecticut, which allowed for married couples to have access to birth control, and then Baer versus Eisenstadt, which allowed for all women, despite marital status, to have access to safe and effective birth control. In the 80s, low hormonal pills, along with copper IUDs, were introduced, along with the increasing awareness of emergency contraception. In 2012, birth control was covered under the Affordable Care Act, which said that most insurance providers had to cover birth control with no copay. 2013, emergency contraception is now available without prescription and on drugstore shelves. Today, there is an increasing study and awareness in birth control options for men. So sex education policies in the U.S. vary state by state, and they're a little vague in their literature. In 25 states plus D.C., they require sex education in public schools, but not private. Only 22 of those states require additional information on HIV in their sexual education programs. 13 of the states require sex education to be medically accurate, which is less than half of all states. However, a large amount, 37 states, allow for parents to remove their child from sexual education instruction if they deem it necessary. One of the most popular sexual education programs is the abstinence-only policy. So far, 37 states in the country have present abstinence-only policies. 27 of those states require that the program be stressed. Less than half of all states in the United States require sex education to include information on all types of birth control, not just abstinence only. And they found that in states where abstinence only is stressed in sex education, there is less likely to have any types of birth control used during sex. In a study in 2011 by Stanger, Hall, and Hall, they studied the correlation between the number of pregnancies and the stress level of abstinence-only education across the country to see if it actually worked in preventing teenage pregnancies. They acquired data from all 50 states on adolescents 15 to 19 years old, but excluded North Dakota and Wyoming as their data was the same and they had no abstinence-only programs. Secondary factors examined were socioeconomic status, ethnicity, level of education, and Medicaid waivers. The results overall stated that states with a higher stress level of abstinence only on a scale of 0 to 3, where 3 meant that they stressed the program the most, and 0 said they either had no policy on it or did not stress it much, and they had higher rates of teen pregnancy. With socioeconomic status, they found that low-income households had the most unwanted teenage pregnancies, and ethnicity-based, it stated that white teen populations didn't stress abstinence only as much as states with higher Black teen populations. However, level of education and Medicaid waivers found no significant evidence to differentiate any difference and found almost identical information. Here we have just the results between all the secondary factors, and it also states teen pregnancies per 1,000 girls plus abortion rates and the birth rates, along with SAT levels and ethnicity rates.